Okay, it is 6 o'clock. So welcome everyone to the Dayton VA Medical Center's Learning About the PACT Act webinar. We're thrilled to be with you here tonight. I want to start by saying this event is being recorded, so if there is something that you missed and later want to rewatch, you'll be able to do that. We will be sending you a link to that recording after that event. Also, if it's something you want to share with folks you feel may benefit, you can provide that to them also. I'm Brandon Zeta with the Community Outreach Office at the Medical Center. I'm a Marine Corps veteran, and like many of you, once had many questions about VA healthcare. So let's see if we can answer your questions this evening about PACT Act benefits and healthcare through the VA. Please realize that as a participant in this session, your microphone has been muted to minimize distracting background noises. We have quite a few participants on the webinar, and that's why we're keeping you muted. Excuse me. This is simply to ensure that there isn't an excess of distracting noises. This doesn't mean we don't want to hear from you. If you have a question or concern, you can share it with the panelists through the chat pane. You should be able to find this pane in the bottom right of your screen. Simply type in your question and one of the presenters will get with you as soon as they can. For the sake of time, if we don't get to your question during this presentation, you can reach us by phone or email and we'll provide that information to you at the end of the presentation. For those of you that are not aware, 14 months ago, President Biden signed into law the PACT Act, which is expanding healthcare to more than 6 million veterans, many of whom were not able to receive care through the VA. The PACT Act is perhaps the largest healthcare and benefit expansion in VA history. The full name of the law is the Sergeant First Class Keith Robinson, honoring our promise to address comprehensive toxins, PACT Act. It expands and extends eligibility for VA healthcare for veterans with toxic exposures and veterans of the Vietnam, Gulf War, and post 9/11 eras. It adds more than 20 presumptive conditions for burn pits and other toxic exposures. It adds more presumptive exposure locations for Agent Orange and radiation. It requires VA to provide a toxic exposure screening to every veteran enrolled in VA healthcare. It helps us improve research, staff education, and treatment related to toxic exposures. And for those who are already enrolled with VHA, this legislation affords many the opportunity to acquire or increase their disability rating based on presumptive conditions associated with military service during a wide range of military conflicts and theaters of operations identified in the PACT Act. And that's why we are here tonight to talk about the PACT Act and how the PACT Act might increase your access to VA healthcare and benefits. We have with us live this evening some experts to help answer your questions that you may have. We have with us Mr. Mark Rohner, our PACT Act Program Manager for the Dayton VA, Chris Cox from Enrollment and Eligibility, the Dayton VA Medical Center, and also Mr. Larry Zietlow from VBA in Cleveland. Again, I am your host, Brandon Zeta, with the Medical Center's Community Outreach, and I will help answer any question you might have about the Dayton VA Medical Center in general. Now, before we begin with questions from our attendees, Mark Rohner is going to give you a brief presentation that goes into more detail about the PACT Act. So please take it away, Mark.
Okay, so the PACT Act. Next slide. As mentioned, the PACT Act is named after Sergeant First Class Keith Robinson, promise to address comprehensive toxins. What that basically means is it's expanding both eligibility for healthcare as well as for benefits for veterans that have some type of a health condition related to toxic exposures. Next slide. And how it does it in several ways. It's expanding the eligibility for benefits and for healthcare. It's improving the decision-making process by creating more presumptive conditions which will help fast track for VBA in making decisions for benefits. All enrolled veterans are going to receive a toxic exposure screening. VA staff are being more educated on toxic exposures, the cause and the effects. It's also gave additional funding for research as a result of exposures. We're able to build a much better workforce. There's been several changes in the recent hiring process throughout VA as a result of the PACT Act. We're able to hire more providers, more staff come on board, and in a much faster method than it used to be. And there's also going to be several new facilities being built. That is not as much going to involve our catchment area. Next slide. Okay, so your Gulf War and post 9/11, how it did this is it did add additional countries that veterans that served in those areas are able to be eligible for presumptive health conditions, Gulf War illness conditions, as well as some of the registries, the Gulf War and the Airborne Hazards Registry. Next slide. They added additional radiation locations for those of you that might have served. It's mainly going to be in the Equatac Atoll is going to be the bulk of them, but also those that were doing B-52 cleanups. Next slide. Your Vietnam era veterans, they added additional locations. The biggest one was Thailand. That was a big game changer for a lot of Vietnam era veterans that were not actually in the Republic of Vietnam. And they also added 2 presumptive conditions: Mucus monoclonal gammopathy of undetermined significance. Basically, if you have that disease, you're going to know it. But hypertension was a really big one. And it also opened up, sorry about that, it opened up some additional enrollment periods that has since passed. So this is a list of the basic presumptive conditions. And here after this slideshow, I'll let Larry Zietlow with VBA, he'll be able to really explain what we mean when we talk about presumptive conditions. Next slide. The toxic exposure screening. So this is being done on all enrolled veterans. So those attending, if you're already enrolled and get your care at a VA, if you've had a primary care visit since November of 2022, you should have had your toxic exposure screening. And those are being done at a minimum every 5 years, depending on how you answer during those screenings. Next slide. This is a listing of the basic congressionally mandated registries, and then as well as some of the most common garrison exposures. Some of these already have presumptive conditions, Camp Lejeune being the single biggest one that is not part of a formal registry. Next slide. And then for filing claims. So with the passing of the PACT Act and the addition of those presumptive conditions, the one big thing to realize, if you previously filed for a condition and were denied, and it is now a presumptive condition, the VA at this time is not going back and opening those claims. The veteran still has to file, and that type of claim would be considered a supplemental claim. And then for the new claims, if you've never filed but you have one of those conditions that are presumptive, we would encourage you to go ahead and file. And even if you have a condition that's not a presumptive, you really feel it's related to your military, we would encourage you to file. See what happens. Next slide. And then another thing with the PACT Act, especially with the addition of all those presumptive conditions, most of which were cancers or other medical conditions that can be considered terminal or that you can pass away from. This opens up if anyone attending this knows someone that has passed away, a veteran from one of those conditions, we would encourage them, their family members, or anyone to go ahead and think about filing for dependency and indemnity compensation, basically survivor benefits. Um, so we would encourage them, go ahead and file, see what benefits can be afforded to that widow or widower. And again, this is reiterating for those, if you've previously been denied, the VA is not going back and reopening those claims. You need to refile for it. And we would encourage you, you can see a veteran service organization. Every county in the state of Ohio has a Veteran Services Commission. Dayton VA has several of the nationally known organizations on site, but also the veteran can reach out to VBA directly as well to file. Next slide. And then if you have any questions, my extension is one up there on the top line, 5807. For the enrollment and eligibility, the office is right there at 5336. We would encourage anyone that's not quite sure if, with the expansion of the eligibility, if they qualify, to give them a call and see what the eligibility office says. You can also go to va.gov to find out more information. And then for the VHA registries, that's the site to take you and it'll explain all the different specifics of those registries. And that's really in a nutshell what the PACT Act is. And now we can open up to some different questions, or if Larry would like to really go in depth about what the presumptive conditions are.
Let's take some of the questions first, and we can move that, and then I'll add in, as we go along, or I can reinforce what you've already said, Mark, a little later.
Okay, perfect. Thanks, Mark. Thanks, Larry. That was some great information, and we probably will get some questions on presumptive conditions. So we do have some in the queue right now. So question one, how does a veteran get enrolled into the VA? Chris, that's probably something you want to tackle.
So great question. To get enrolled at the VA, well, you can come in person. All you need to bring is your DD-214, and then also swing by our office. Our office is located on the first floor. If you came in through the main hospital in Dayton, take a left, you see the green desk. You'll see our office right there. Or if you would like, you can also do it online at va.gov. And then also, if you have any questions or you just want to even set up an appointment, you don't need an appointment, but if you want to call ahead of time and find out our hours are from 8 a.m. until 1600 or 4 p.m. We'll be more than happy to help you out.
Thank you, Chris. Tim has asked, is there a cutoff date to register for the PACT Act?
I can take it. There is no cutoff date there is no real register for the PACT Act and a cutoff date. There were cutoff dates. One dealt with filing for benefits and having those go retroactive earnings to the filing or the signing of the PACT Act. That has since passed. That was August 10th of 2023 because President Biden signed the PACT Act August 9th of 2022. So there was that 1 year that has since passed. And then there was an expansion of 1 year for special combat veterans to be able to enroll if they had served in a combat theater of operations since 2013. They had until September 30th of this year. That has also since passed. But as far as just filing for any benefits, and Larry can piggyback on there is no date. They can file whenever.
Now, see, thanks, Mark. Here's an important thing to think about. We're stressing the PACT Act here, and there's all this talk about August 10th and August 10th of 22 when the law was signed, August 10th of 23 when the 1 year period ended. And I'm concerned that there are people out there who believe, oh, I've missed my window. I can't apply for any of this. I can't apply for any benefits at all. And that's just not true. You can always apply for VA disability compensation. And PACT Act disabilities, if you have them, if you find that you have now got presumptive service-connected conditions, because we changed or added some locations where you may have served. I've helped 2 or 3 veterans in the last year who served in Guam now are eligible for the full range of Agent Orange disabilities, and there are quite a few of them. So you can always apply for disability compensation. The 1 year thing was to get your date of claim to be retroactive back to August of 2022. That ship has sailed. And if you file a claim now, your benefits will be effective the day you file the claim, regardless of how long it takes us to process that claim. And it's taken us anywhere from 4 to 6 months to process disability claims right now. The effective date or your payment date would be from the date you file the claim. Any monies we pay out would be paid retroactive to that date.
Okay, great. Thank you very much, both of you. I have another question. Perhaps Chris could answer this. How long does a Title 10 deployment for Guard Reserve have to last to be eligible for VA health care?
That's a great question. So as far as the Guard members, so when it comes to the PACT Act, if you're filing for a claim with the PACT Act, if you are approved for a disability, there is no timetable as far as how long you need to have served. If you have a disability, you're eligible to be seen. You're eligible for care at the facility. As far as Guard and Reserve, you need at least 24 months of active service without a disability to receive care.
Thank you.
Let me add one thing onto that, because again, we're talking about the PACT Act. It's important for all veterans to understand that any disability that is considered service connected, regardless of how long a period of time that you served, you will be eligible for medical treatment for that disability based on being granted. As Chris said, for things that are not service connected, you need the 2 years, you need more time, you need more eligibility. But for things that are considered direct service connection, you'll be eligible for treatment for that particular disability. There are other eligibility requirements that may make you eligible for more care, but that's the one, and that's true of all disability claims.
Yes, thank you, Larry.
Great, thank you. Question has just come in. How do I know if my deployment is considered combat status?
So I can take that unless you want to, Chris. For the most part, for that type of question, you would want to look, did you serve in one of those areas on the previous slide, the Southwest Theater of Operations? Or did you deploy somewhere and on your DD-214, is that showing you receiving imminent danger pay? If it does, more than likely, when you go to enroll, the system may flag you as ineligible, but that's where it would then be sent to a healthcare eligibility center, and they would review that on a much more case by case basis.
Okay, thanks, Mark. How can I tell if I'm on the Agent Orange registry?
For that, you would want to contact on the slide, the number 3259. That is the office for the Environmental Health Registry Department, and they would be able to look you up into that database and see if you are listed. If you are not, and you are already enrolled, we would just have you have your primary care provider place a referral to the registry department, and then we will go ahead and get you set up and scheduled for an Agent Orange registry. If you are not enrolled, this is where you would have to go see the enrollment department and get set up, and then we can go ahead and get you seen for the registry.
Another question, Camp Lejeune contaminated water is not a part of the PACT Act?
So Camp Lejeune contaminated water. Camp Lejeune contaminated water has one small provision in the law of the PACT Act itself. And what that provision says is it allows for people who were affected by Camp Lejeune to file a civil lawsuit against the Department of Veterans Affairs for conditions and disabilities related to their Camp Lejeune service. That's the only thing that's in the PACT Act related to Camp Lejeune. There is another law that covers the Camp Lejeune, the veterans who served in Camp Lejeune, those veterans who served, and I don't have the dates and I don't have that all of that with me, but you can get that online by simply going into Google and typing in Camp Lejeune water, and you'll get all of the data that is there. But the Camp Lejeune Water Act that was passed quite some time ago allows for a particular group of disabilities, mostly cancers, that if a veteran served on board Camp Lejeune during the appropriate times for the appropriate length of time, then they would be those disabilities would be considered presumptive as well. Now, we've used the word presumptive a couple of times, and this would probably be a good time to decide to explain exactly what we mean when we say presumptive service connection. In order to be considered service-connected disabled, three things have to exist. There has to be an incident or a condition or a disease or an injury that happened during the military service. There has to be a current chronic condition. And there has to be a link between the current condition and the military service. For example, if you were injured during the military service and you had a knee blown out for whatever reason, and you suffer from a condition of that knee now, and that condition has existed all the while since you got out of the military, you would have a current condition, you would have a known incident that happened in the military, and there would be that link. And that would allow us to give you service-connected disability, or at least give you a service-connected rating for that particular condition. Well, in the case of presumptive service connection, and this goes back to well before the Vietnam era, but it goes back to the Agent Orange thing, right? A lot of the conditions that were noted and were found to be determined to be related to the exposure to Agent Orange, well, they certainly did not come up when the individual was first in the military. And so it was determined through a variety of studies over the years that if you served in Vietnam and you suffered from one of these presumptive conditions, you would not have to prove a link, or you would not have to prove anything about that disability. If you served and you have the disability now, it is presumed that it is service connected. And there is a long list of Vietnam, of Agent Orange related conditions that are considered presumptive to that service. And there are now a list of presumptive illnesses and cancers related to Gulf War, related to, post 9/11 service, that are considered presumptive service connected. If the condition has been medically diagnosed, you go to the medical center, they diagnose you with one of these cancers, they diagnose that you actually have the condition, then you can file a claim for service-connected disability, and we can presume service connect the condition, and possibly pay disability compensation. One of the key elements, though, is that it must be, you must have a current diagnosis. So If you think that you may have one of these conditions, or if you're concerned about whether or not you have them, see your primary care physician, ask him about these conditions, see if you have in fact got a diagnosed disability here, and then we'll talk a little bit later about how to actually file a claim for disability. But so as Mark mentioned earlier, we're not going back to determine whether or not previously denied disabilities, which now are considered presumptive based on the PACT Act, should be readjudicated. You are going to have to look at your records, look at the lists of these disabilities, and inquire to us as to whether or not we have previously denied this and you need to reopen that claim. So say, for example, you had chronic bronchitis and we denied the chronic bronchitis because there was no evidence of treatment, there was no evidence of service of this condition while you were in the military. Well, now chronic bronchitis is one of the presumptive illnesses. And all you have to do now is come back and say, I'm filing for chronic bronchitis under the PACT Act. And we will go in and do the work we need to do in order to get that disability service connected.
Perfect. Thank you, Larry. That's good information. We have a couple more questions. Barry is asking, I received a letter in the mail saying I may qualify for benefits because of the PACT Act. What do I do now?
I'm sorry, could you repeat the question?
Yeah. I received a letter in the mail saying I may qualify for benefits because of the PACT Act. What do I do now?
Those letters were sent out to thousands upon thousands of people. It was simply an announcement of the PACT Act. It put a lot of information out there and encouraged people to contact us. So the thing to do is to, as I talked about a moment ago, if you feel you may have one of these conditions that are listed, and the full list is available online, if you feel you may have one of these things, contact the medical center. Talk to the medical center about toxic exposure examinations and getting on the various registries that come with this. Talk to the veteran service officers. Mark mentioned earlier, there are veteran service officers at the VA Medical Center. You have county veteran service officers. Each county has a veteran service commission, and you can find that information online as well as to where the one is in your particular county. And let the county veteran service officers and the like go through your records and interview you. Because even if you don't necessarily have something that's on this list, I'm certain it's been a long time since you thought about whether or not a particular situation or condition you have might be related to military service. And we'd like the opportunity to look through your entire records and determine whether there's anything going on in your life that we might be able to find that are service connected, especially if you're a Vietnam era veteran, because there have been a lot of disabilities added to the Agent Orange list over the years. And something that you may have had a long time ago that you never even thought about, even if it's not covered by the PACT Act, is still covered under the presumptive service connection for Agent Orange. So let us get a chance to review your records with you.
Great, thank you. Another question from Robert. I'm already service connected for the Gulf War. Why should I join a registry?
So there is a difference between being service connected for a medical condition, like as a result of your time serving in the Gulf War, and being on the Gulf War registry. Those are two separate programs, separate processes. They do play off of each other a little bit, but they are separate. Now, the purposes of a registry serve two main purposes. One is to educate you, the veteran, about your health, your type of exposures, and the different health conditions you need to be aware of and thinking about in case you ever develop them. But also, it, in a sense, is data gathering and collection for the VA. When we talk about presumptive conditions, This is one of the areas where the VA decides and makes decisions on presumptive conditions or policy making determinations based on what the data shows us. Okay, the veterans that served in this area at this time, they're developing these type of health conditions. We need to look at research. So it's even if you are, say, at 100% service connected, a lot of people decide I don't want to mess with being a registry. Well, it'll also help your other fellow veterans as well. Let us see you. Get on the registry. Find out any more additional information. What health conditions do you have? Maybe you have a health condition at this time that isn't a presumptive condition. We get enough people joining the registry, it may become a presumptive condition. Hypertension, lack of a better term, it took half a century before hypertension became a presumptive condition. So this is a way that helps the VA get that information and data collection for policy decisions, but also educate yourself on your health.
Perfect. Thanks, Mark. Sarah wants to know, can a non-enrolled veteran just pay out of pocket for screening?
The answer at this time, no. The way the PACT Act was set up, it is for enrolled veterans to receive a toxic exposure screening. Now, there would be two things with that. One to think about, if you are not enrolled, go to the eligibility and enrollment department. Take your DD-214, take your ID, let them run you through the system. If you wind up getting enrolled, we're going to be able to go ahead and do that toxic exposure screening, and you also could be eligible for some various health care. If at that time you were not considered eligible for enrollment, that doesn't mean the VA is not going to allow you. That's where you would go to the Veteran Benefits Administration, the Veteran Service Organizations, talk to them about health conditions. If you have an exposure concern, talk to them about that exposure concern. Maybe you do have a health condition that if you file and you get granted service connection, now you are eligible for Veterans Health Administration and healthcare, and then can get a formal toxic screening.
Thank you. Barry says he was at Camp Pendleton and they burned everything. Can he sign up for the burn pit registry?
No. Registries were created by Congress for a specific demographic group of people that served in a specific region during a specific time frame. But that doesn't mean his exposure concerns are of no value or no concern of the VA. We do have, you would not qualify for the burn pit registry. The Dayton VA does non-registry exposure assessments. You would be eligible for that, and you could still, and we would encourage you to do, you could file for, if you have a health condition similar to one of those that are on the burn pits, a presumptive condition, we would encourage you to still file. You still had the exposure. You still have possibly the negative effects of that exposure. File for it. But that's where at that time it would not be considered presumptive condition. And that, I like to explain it, there's a little bit of homework to be done on the part of the veteran to help make that nexus or that connection from that condition. And Larry, if you want to piggyback or expand more on that.
Yeah, so this is a good, this is a really good example. So you were exposed to burn pits, but not in one of the presumptive areas that we spoke of. If you are suffering from a condition, let's use chronic bronchitis because it's the one I used before. You're suffering from chronic bronchitis, and so you say, well, I believe it was related to my military service. We will then since it's not going to be an automatic grant, we'll get your service medical records. We'll get your service personnel records. We will do the research to determine whether or not that you were in that particular location. And if there's any evidence of treatment for disabilities that you're claiming in your service medical record, now we can say, look, this existed in the medical record. He suffers from this condition right now. And we have the two basic elements of service connection. We would then do an examination. We'd do a compensation and pension examination, and we would ask the doctor, is it least as likely as not that the current condition that the veteran has is related to their military service? And to ask the question that way, is it least as likely as not, is absolutely the lowest threshold of proof, if you will, that you can ask anybody for anything. It's not even a 51-50 type of thing. If the doctor feels that there is the remotest chance that your current condition could be related to your military service, they are going to come back with a recommendation that says that it is as least as likely as not that this particular incident is caused by the military service, and we would then be in a position to grant service connection for that disability. But as Mark says, it takes more homework, it takes more research, we've got to get more records. There may be more things you as the veteran, the claimant, have to do, more information for you to gather, but that's the way the normal process would work on that particular disability. If we were to ever come along and say, okay, burn pits at other bases were causing these problems, then you would see it added to the presumptive disability list. Thank you.
Sorry. That is it for the questions. Do any of the three panelists have anything you'd like to add before we kind of wind things up here?
I would just like to add, as Larry was just saying, the threshold to obtain benefits is actually somewhat low, and we really, really do encourage people, file for your benefits. Go to the VA Medical Center if you're not currently enrolled. Let enrollment and eligibility run you through the system. We want the veterans to obtain the benefits that they're deserving and the health care.
Okay.
And the PACT Act is just helping that.
Absolutely. Please don't get the idea, and some veterans have said this, and they say, well, my disabilities aren't so bad. Other veterans need it more than I do, or words to that effect. Please understand that these benefits are benefits that you have a right to. You went into the military as a 100% whole, sound, healthy individual. Something happened in the military that caused a disability, that caused a health concern, and you are entitled to both the compensation for that disability and the health care for that disability. We owe you that because of your service. Please take advantage of that. Don't worry about other veterans. There is enough to go around. We will always have enough both health care and benefit money to go around. So please go ahead and file. Talk to your veteran service officer. Talk to your county veterans service officer in your local county. See the folks at the medical center. Please don't give your ID. Don't take your ideas from the guy at the VFW bar. Get a professional to help you with this and get some professional advice on how to apply for the benefits that you deserve.
Well said, both of you. Thank you very much. Well, I think that's all the time we have for this evening's session. And we hope you found this both helpful and informative. And to anyone that we did not get to your question, please don't worry. That if it's something you did not want to share with the group, feel free to contact the PACT Act program office at 937-268-6511. I'll give you two extensions, 5807 or 3259. That's 5807 or 3259. And to file a PACT Act claim through VBA, go to www.va.gov/PACT. And as a reminder, filing a claim through the PACT Act does not automatically enroll you in VA healthcare. Claims only determine eligibility for benefits through the PACT Act. You must still apply for healthcare benefits through the Veterans Health Administration.
For further information about veterans benefits, to get more PACT Act information or more information about claims that you might want to file, to check the status of any claim that you might have, or to just find out what the heck we were talking about tonight, you can call the Veterans Benefits Administration at 1-800-827-1000. And a counselor on that line will be able to refer you and provide you with guidance and information for Veterans Benefits Administration.
Perfect. Thank you, Larry. For any information about applying for VA healthcare, you may call our eligibility and enrollment office here at the Dayton VA at 937-267-7608. Questions about how to enroll in the Dayton VA. You also see the number on the screen for eligibility enrollment. That's 937-268-6511, extension 5336. For those who may not currently be enrolled in VA healthcare, there are several options for enrolling. As has been mentioned already, you can do it in person here at the Dayton VA. Chris also mentioned online. You can call the call center, and you can submit an application through postal mail. You can also enroll in the surrounding community-based outpatient clinics, also known as CBOCs. They are located in Lima, Middletown, Springfield, and in Richmond, Indiana. I'd like to say thanks to our panelists for all the great information they have shared with us this evening. And thanks again, everyone who attended this event. Have a great rest of your evening. And thanks to all our veterans for their service to a grateful nation.